Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, we'll be talking with a physical therapist, Joel Desautels, and he's going to be talking about post-concussion management, what it means and what services that NMC offers. So, Joel, thank you for joining us today.
Thanks for having me, Jill.
So I know you haven't been on the show before.
That's right.
I'll tell you what, once you're on once, there could be multiple times, so I'll warn you. But
you
become a pro.
Quickly.
So tell us a little bit about who you are and your background, just to let viewers know a little bit about you.
Well, I'm originally from Franklin County. I graduated from Richford High School, actually, and
Nice.
continued my education at Castleton State College before it was Castleton University was a while ago. So, worked as an athletic trainer here in Vermont for the Sports and Orthopedic Rehab Center and also at a local high school. Decided to go on to the University of Delaware, where I got my master's degree in physical therapy. After Delaware, my wife and I moved out to Arizona, to the Phoenix area, and I directed a sports and orthopedic clinic for physical therapy out there.
Wow.
And then about 12 years ago now, my wife and I decided to come back and start a family, and moved around to a few towns, but have ended up in Georgia, back in Franklin County, where we were both born and raised here. So very excited to be back in the community.
That's terrific. That's fantastic. So now we start the conversation about concussion. So what is the true definition of concussion, and how does that differ from a head injury?
Sure. Yeah, that's it's a difficult question. There's a few medical groups that have a little bit of a different spin on the true definition of a concussion. I think probably the most straightforward, easy answer is that it's a complex process that affects the brain, usually induced by mechanical force. And it doesn't have to be it either can be from a direct blow to the head, neck, or face, but also can be a blow to the body, which imparts a mechanical force on the brain. So the diagnosis of a concussion typically comes about from looking at a range of things like symptoms, physical signs, cognitive impairments, behavioral disturbances, sleep disturbances. So it's a process as far as the true definition and becoming into that concussion diagnosis, I guess we would say. And head injuries can be things like lacerations, skull fractures, and those things can be with or without the additional diagnosis of a concussion. And again, that research is definitely continuing in this area. So that's why there are some groups that don't like the term concussion or post-concussion anymore, and are trying to really define it a little bit differently, and why people continue to have symptom problems.
So are concussions just about athletes, or who has a concussion and who has a head injury? Does it differentiate?
Also a very good question. So in the media lately, it's the athletic world gets a lot of the coverage, and I think it's about 4 million cases are reported in the U.S. per year, close to that, and a lot go unreported. I think in the last few years, with more of the media coverage and more efforts on diagnosis and recognition of concussions, we're hearing about it a lot more. But again, the athletic world seems to have it a little bit more in the forefront, but folks in the community can definitely, especially here in Vermont with falls on the ice and motor vehicle accidents and even issues that happen at work. You can have, I've seen many folks who have objects fall onto them, and so work-related concussions are definitely an issue as well. So So it's not just about athletes. It's everyone in the community can deal with these sort of things, and then you know, again, the athletes are sort of seeing when can they get back to sports, but people in the community, students, when you know, return to learn has become a big topic, but also if you're in the community and you are involved in a motor vehicle accident and have a concussion, you know, the struggle to get back to work and just some things with your normal daily activities can also be an issue as people are recovering.
Mm-hmm. So tell us a little bit about the post-concussion program that you're bringing to NMC.
Sure. So in the last 5 to 10 years, I've segued from, well, actually going back about 20 years, my initial experience as an athletic trainer, sideline management of concussions in many different athletic roles. In the last 5 to 10 years as a physical therapist, I've kind of looked into the research and developed a post-concussion program, which is widely accepted across, you know, across the medical world through leading researchers. That the response before was, you know, rest, and keep resting until you recover. Well, research in the last 10 years has shown that's not really the best thing to do, and controlled activity has been shown to be a positive thing, and kind of combating the effects of more deconditioning, depression, and just those whole effects of sort of waiting to get better is not necessarily the case. And it's true where there's you know, initial period of rest is a good thing, but now with controlled activity, hopefully we can help with recovery. So the program that I'm bringing to NMC is sort of that aspect of an evaluation process that has a few different stages to it, and the biggest part is education on symptom management and education on controlled activity level to help recover from symptoms that are prolonged, you know, kind of learn strategies to deal with those symptoms and progress back to all of those things that we talked about earlier: school, sports, work, and just normal home life, recreational activities.
So what are the symptoms that people would be seeing in order to come to a program or think about your program? What should they be looking for, or you know, what is that referral? How do they know to come to this post-concussion program?
Yeah, so you know, we talked about concussions can happen to anyone at any age.
Right,
so you know, recognizing that, suspecting that either yourself that maybe you've had a concussion, or the people around you maybe recognizing that, and knowing that seeking out, you know, a trained medical professional is important, so that you know, we talked about the initial rest period, seek out some medical attention, and then you know, if symptoms are prolonged, and there's a whole list of symptoms, we in the program and most standardized assessment tools use a graded symptom checklist, which is 22 different symptoms, and it can go from headache, nausea, dizziness, difficulty concentrating, difficulty remembering, fatigue and low energy, changes in mood, emotions, trouble with sleep. So all of those things can be seen initially, and initially can actually deteriorate, and then can unfortunately prolong. Most concussions, most individuals with concussions recover in a reasonable amount of time. So, but there's a fraction of people who don't, and it kind of is prolonged. And again, that's where we can start doing some controlled activity. So, if to your question, if you have these prolonged symptoms, and hopefully you've already been speaking with your medical professional about that, they can help steer you in our direction. You don't necessarily need to come directly from your provider, because you can always call us at Northwestern Medical Center and ask some of those questions and see if you're appropriate to be immersed into our post-concussion program.
So folks could call. Do folks know that when you call Northwestern Medical Center that I want to be connected to the post-concussion program, or is it physical therapy, or how do folks access you if they're making that call? Who do they ask
Sure.
for?
So we have a couple different levels. First of all, our certified athletic trainers in the schools do a great job managing.
That's a good access.
Their student athletes who are injured on the field, and again, they go through a criteria which is a return to play criteria, and again, most of them recover and get back on the field. Students who don't have access to athletic trainers, we're now offering a return to play program through Northwestern Medical, where students can come and our athletic trainers will assess them in the clinic and help them through that progression, hopefully back to school, back to sports if they're not into sports, and just back to normal things that they like to do. If they struggle getting through that, then we can immerse them into our post-concussion program. So that's one way, sort of for the student population. But individuals in the community can do the same. They can call with those questions, and they certainly can. We can reach back out to them and have a conversation with them, or we can have them into the clinic and do a formal assessment and sort of steer them in the right direction. Because the other things that physical therapy can benefit from, the musculoskeletal issues that often come up, the cervical strains and muscular issues that can prolong headaches and other symptoms. So those type of things, are very commonly addressed in physical therapy. And we can also see if there's other things going on with these prolonged symptoms that we can use some of the post-concussion program strategies. At Northwestern, we also have, therapists who are treating for vestibular and ongoing vision problems, which can often happen after a head injury. We have access to occupational therapy, so if there's some executive functioning things that folks are struggling with daily tasks or return to work, we have a lot of options at Northwestern Medical Center to help people recover from their injury.
That's great. Now, is there a special training for concussion management? Do you have a different training than other therapists maybe for concussion? Is there a special training for that?
Yeah, that's a good question. I think a lot of it, yes. All physical therapists aren't necessarily adept at all of the concussion research and types of the programs. Just as in physical therapy, we as clinicians specialize. There's neurologically trained physical therapists, orthopedically trained physical therapists. So the concussion treatment is a little bit specialized as well. And if it's something that, as a clinician, you're interested in, and obviously there's the need for it, we go on and get other continuing education and look into the research. It's always changing, just like most things in the medical world. There's definitely some evidence-based practices going on with post-concussion treatment.
And if someone comes for the treatment, what's maybe give an idea of what's one or two of the strategies that you might use? I know people are different, but what can they expect when they come to your clinic? What are you going to do with them?
Yeah, that's a great question. I think the two biggest things are learning about symptom management. So when patients come in, I think a lot of times it's refreshing that they're getting asked the right questions, and we have patients oftentimes that have said this to me, like, nobody's asked me about that, and that's exactly how I feel, about the situation. I just don't feel right, or you can't quite. It's not like a knee injury where you're asking about pain, because it's a whole connection to the body. It's a brain injury that just makes you feel not right all over at times. So learning about symptoms, learning about how to track those symptoms. So we go over the graded symptom checklist, and sort of like knee pain. If I ask you how your knee is feeling and give me a 0 to 10 scale, you can say, oh, it's a 5. If 10 is unimaginable pain, it's a 5 today. So we teach some of that and get them to track their symptoms and also have strategies then to know how to control that. So that's one thing. And then the other thing is using that symptom tracking. It's getting back into being active, because again, initially it's good to rest, and in the past, the approach has been keep resting, and eventually you'll feel better. But that's not seen as the best approach now. So I think sometimes people don't know: am I supposed to be resting still, or am I supposed to start being active? So we help them through that progression, starting very slowly and managing other things like sensitivity to light, sensitivity to noise, giving them ways that they can manage some of those different variables that maybe they haven't thought of themselves or just haven't communicated it well with others.
Wow, thank you.
Yeah,
Our time has flown. I'm sure you'll be back again to talk more about this as the clinic gets established. Where are you located? So just in the last kind of 10 seconds here,
Sure.
Where can we find you?
Sure. Physical therapist at all of the Northwestern Medical Center rehab clinics are actively, we're continuing to train and be involved with the post-concussion program. I personally am at the Georgia site, but physical therapists at the Cobblestone site and the Enosburg site are ongoing with the post-concussion program.
Beautiful. Thank you.
Yeah,
thank you for doing this. It's it's an important service to offer. So thank you for doing that.
Thank you.
Yeah. I'm Jill Bowen, your host of the Health Beat Show. Wow, we've learned a lot about concussion and the importance of that, and to seeking support in your recovery. So please reach out to Joel and our physical therapist at Northwestern Medical Center to see how we can help you and your family should you have a head injury or a concussion that you need support for. So thank you very much for joining us today.